Hello, my name is Nicole Panek. Today's date is September 26, 2024, and today I will be demonstrating how to perform tracheal suctioning on a open system. So prior to the procedure, we always want to check the patient's chart and verify the orders first. We also want to assess the need for suctioning by auscultating the patient's lung sounds, assessing respiratory status, and observing for tracheal secretions. At this point, once we have confirmed that suctioning is needed, we will then go ahead and gather our supplies and return back to the patient's room. At this point, we also do want to assess for pain to make sure that the patient is comfortable during this process, or administer as they request. So now that we have gathered our supplies, we enter the patient's room, obviously identify ourselves, and we want to identify the patient by a name and date of birth or a wrist bracelet if they have. So at this point, we want to then explain the procedure to the patient and answer any questions that they may have concerning the procedure. So we have assembled all of our supplies onto the bedside table. We're going to perform hand hygiene, provide privacy, and return back. At this point, we will go ahead and make sure that our wall suction is functioning properly. And for demonstration purposes, this is an extension cord that I'm using as the tubing. We want to set the suction to 100 to 150 millimeters per mercury for an adult. So at this point, we have the suction going. We're going to raise the bed to a comfortable working height, and we are also going to place the patient, a conscious patient, in a semi-Fowler's position, and an unconscious patient we would set in a lateral or sideline position, facing the nurse that's performing the suctioning. So now that the patient understands the procedure and we've answered any questions they may have, we're good to go ahead and prep the patient. So we are going to do that by placing a towel or an absorbent pad on their chest. And I'm going to move this camera so you can see. So now we're going to go ahead and prep the supplies needed to perform the suctioning. So what we want to do first is go ahead and we're going to open the sterile pack, and we're going to open it away from my body, and we're going to go ahead and grab the container and open that, making sure to only touch the outside of the container, and we're going to set this off to the side, and then we're going to go ahead and we're going to pour our water into the container. So now that we have that area prepped, we're going to go ahead and take our sterile gloves, and we're going to open our sterile gloves. Oh, and before we do put our sterile gloves on, we want to make sure that we put any other PPE that's necessary, as far as goggles, face shield, that kind of thing. So now that we have everything on, we're going to go ahead and don our sterile gloves. So now that we have our sterile gloves on, we're going to go ahead and we're going to grab the packaging with the tubing in it, and making sure that we're careful with how we take it out, because it could uncoil and touch an unsterile surface. So this is the tubing. We're going to go ahead and wrap this around the non-dominant hand and securing it here in our hand. So this, my right hand is my dominant, so this will be the sterile hand. My left hand is non-dominant, and that will be what is going to be considered clean and touching the wall suctioning tubing to connect the Y tube. So we're going to go ahead and we're going to grab that and attach it. And obviously, again, for demonstrating purposes, this doesn't stick together, so I'm just going to set that down to the side. In a real situation, it would be connected. So at this point, I'm going to go ahead and uncoil this. And we're going to place this into the water, and we're going to test the suction by occluding our thumb over the hole and providing suction. So now at this point, we are going to remove the patient's oxygen source, and before donning anything sterile, we will have all of our supplies in hand and close by. That includes a resuscitation bag and anything else that we may need for this procedure. We'll have the resuscitation bag close, so we're going to go ahead and coil this around. We're going to go ahead and remove oxygen source, and then we're going to hyperoxygenate for about 30 seconds prior to suctioning. So we're hyperoxygenating, and then we're going to set that to the side, and then we're going to go ahead and begin our suctioning process. We want to make sure that we don't have our thumb over the hole to create suction. We want to make sure it's open as we enter into the tracheostomy. So now that we're ready, we're going to go ahead and enter into the tracheostomy site carefully, and we slowly go down. When the patient coughs, we know we're in the right spot, and we're going to go ahead and occlude the hole, and in a circular motion provide our suctioning and bring it on out. And we don't want to do that for longer than 10 to 15 seconds, and we want to allow the patient at least 30 seconds rest. And we don't want to exceed three passes in one suctioning cycle. So at this point, we assess and make sure that the patient doesn't need any further suctioning. So once the patient is successfully suctioned, we want to clear out our water, and then we want to make sure that we hyperoxygenate the patient before and after suctioning. And then we're going to go ahead and replace our oxygen source, and then we're going to coil this up, and we're going to place it in the glove like so, and discard of our supplies here. So once the patient is complete with the suctioning, we will then put them back into a comfortable position, assess their lung sounds and their respiratory status once again, and obtain any vital signs necessary, and then give them their call bell, and we will then chart how the patient tolerated the procedure and any other pertinent information that the physician may need to know. And I do believe that that is it. Thank you.